September is dedicated to suicide prevention awareness. So, our podcast this month will be used to shed light on this public health challenge. You may find this conversation challenging. If you have any mental health challenge or you know someone who's struggling with thoughts of self harm or suicide, please contact us on 0706 062 5054 and we'll be able to offer you support. Hello and welcome to the Mind Clinic. I am Chinyerugo, a clinical psychologist. And on this episode, as we talked about earlier, I will be speaking on suicide prevention. I hope you were able to listen to the last conversation we had talking on suicide prevention advocacy. If you didn't, please go back. Thank you for your continuous patronage and listening to our content. Our social media handles are Neem Sanctuary. You can reach us on Instagram and Twitter. On this episode, we'll be speaking with two amazing guests. We have Aisha Buba and we have Dr. Nancy Ojinta. I'm going to be reading their bios for you so you know who we're speaking to. So we'll start with Aisha Buba. Aisha Buba is a psychologist and executive director of the Sunshine series, a mental health company based in Nigeria with a non-profit arm called Idima. Her expertise and area of focus involve helping clients in therapy to address life and mental health issues. She also has an interest in training mental health first responders and lay counselors. She's a strong voice of advocacy for better mental health practices in Nigeria. She's a 2023 Mandela Washington Fellow and an Echoing Green Fellow. Hello, Aisha. Welcome to this podcast.
Thank you.
Great. So our next guest is Dr. Ojinta Nancy. She's a consultant psychiatrist, a fellow of the West African College of Physicians, a member of the American Psychiatric Association, a member of the Biological Psychiatric Society of Nigeria, and a Johns Hopkins University Certificate Psychological First Aid Provider. She has over a decade of experience in the management of a wide range of psychiatric conditions at the renowned Federal Neuropsychiatric Hospital, Yaba, Lagos. She now works as a consultant psychiatrist at the Oliester Wellbeing and Recovery Center, Abuja. Her career is focused on clinical work and research. See, I have really amazing guests. She has a passion for promoting healthy lifestyles as a means to prevent and manage mental health conditions. Hence, she works with Sleep 729. I think she's going to give us more information on that. As a service provider for sleep problems. She's also the founder and clinical director of PsychGam Services, an organization that is setting the pace in awareness creation, assessment, and management of gambling addiction in Nigeria. Can we please firstly start with giving a round of applause to our amazing guests that are here with us, please? Can we have a round of applause? There you go. Great. So let's start with myths that we need to bust. We need to bust some myths because there's a lot of conversation around mental health, especially suicide prevention. So I think we can start with some of these loosely used words and try to get some more understanding on the conversation. So let's start with the first one. Talking about suicide increases the chance of that a person will act on it. Who's gonna go? Dr. Nancy, Aisha?
Yeah.
Okay.
Okay, so hello everyone. So now people erroneously think that talking about suicide or asking a patient whether they have suicidal ideas might actually prompt them or increase the risk of suicide. But there's no concrete evidence to support this fact actually. In fact, on the contrary, if someone has suicidal ideas and is being asked about this tactfully by their clinician, it might even make them feel understood, and that might actually reduce the risk of them going ahead. They might even be able to share their problems more and then get help. So really, that is really a myth.
Thank you. Thank you for that. All right. The second one. People who talk about suicide are just seeking attention. Maybe Aisha, take that one.
That's a myth. They are not seeking attention. It's something that they are really struggling with. So and there are many people who have suicidal ideations and they don't even talk about it and they just go ahead and act on it. So really, if it was attention seeking, they would have talked about it. They would have drawn the attention. So that is a big myth.
Awesome.
But it could be a cry for help.
Mm-hmm.
It could be that the person cannot, the person is trying to express their struggle,
Mhm.
and they probably do not have the right words for it, so their actions may speak louder than their words. So sometimes it could be a cry for help, but unfortunately many a times we don't listen to those cries.
Yeah. Because then we term it as attention seeking.
Yeah, so that's a big myth.
Awesome. Great. Suicide cannot be prevented. That's the third one we have. Suicides cannot be prevented.
In fact, I would say precisely suicides are very preventable. I mean,
Mhm.
among the diseases or causes of death, suicide is a very, very preventable cause of death because there are risk factors for it and you can actually pick those signs so it can be prevented and it really is a loss. If someone dies of cancer, for example, you can say, what could we do? Just try our best. But then suicide, maybe there was a treatment there or medication here or there or support and things change differently and actually prevent that loss of life.
Yeah.
So it's a myth.
Awesome. Thank you.
And I think that's why we have this month as Suicide Prevention Awareness Month, because they are
Exactly.
preventable.
Exactly. Great. The fourth one. People who take their own lives are selfish, they're cowards, or they're weak. What do we say to that?
That's a big fat myth,
Mhm.
because it takes a lot to get to that point where you feel like there is no hope, there is no way out, and you end your life. It's even a minor injury on your skin is uncomfortable. So imagine ending a life. It's a tough situation to be in. So no, having suicidal ideations doesn't make you weak. It doesn't make you a coward. It doesn't make you any of those things. It just means that you are struggling, you can't see a way out, and you are letting go of that pain and struggle. So that's a myth.
Yeah.
I think I want to add to that. In principle, generally, everyone should love themselves. If someone does not love themselves and want to just end it all, that is a problem. So those who commit suicide or have thoughts of death have been found to generally have an abnormal state of mind, like an abnormal state of mind in one way or the other. So really, it shouldn't just be out of selfishness or they don't care for other people. Really, they actually need help more than to be criticized or judged. Yeah.
Definitely. The next one. Suicides always occur without warning.
Okay. Well, sometimes it's difficult to actually predict exactly when or who will commit suicide, right? But there are several risk factors, and actually they point in the right direction if the individual or the clinicians pay attention to these risk factors. So usually there's no warning. I mean, when they do what they call psychological autopsy or trying to like review a suicide after the person has committed the act, right? You find out people say, we observed XYZ, in clinicians, or they've been seeking mental health help at some point. So really, usually there are warning signs that people could actually see. Yeah.
Awesome. Finally, talk therapy and medications do not work.
That's a myth. They work. They've worked for thousands of people, and they will continue to work for millions of people who need it.
Yeah.
Although not everyone who has suicidal ideations would require medication, because it's not always a mental health condition. Sometimes there are social factors that are triggering the suicidal ideation. So in that kind of situation, obviously medications will not help. Changes to those social factors is what would help.
Yeah.
But for those who need medications and therapy, it's very effective.
Amazing. Thank you. I mean, this is just a taste of what's to come. Awesome. So let's go into the conversation with Suicide Prevention Awareness Month. But I like the both of you to just describe that word. What is suicide? To the layman listening, I know you both bring different aspects to the conversation. What is suicide?
Okay, so suicide is an act with a fatal outcome. That means it actually leads to death. Okay, and this act is initiated, or carried out with the intention or the expectation of the fatal outcome. So the person that's trying to do something to take their own life is aware that this will lead me to die. Yeah, so that is what suicide actually means. Yeah.
Awesome. Thank you. See how that was very from a psychiatric point of view. So Aisha, let us know, what is it?
I think it's basically the same thing Dr. Nancy has said. So intentionally causing a sort of bodily harm to yourself, that the outcome is likely going to be death, and the person is fully aware that that's the outcome.
Yeah.
So this is in summary, a person ending their life.
Yeah.
That's what it is.
Yeah. Um, one of the things I've looked into when we're talking about suicide is a lot of lay people think that, oh, this person just wants to die. Um, from your work, as clinicians, is it really about dying? What is it really about? What is this? What brings a person to this point where they say, you know what, I feel like this is it. This fatality, like you're talking about, Dr. Nancy. What is it about? Is it just I want to die? Because a lot of people think that that is what it is.
Okay, so I'll say in most cases of suicide, there's an element of hopelessness. The person does not finds it difficult to continue living. Life is like a big burden. They can't even find a way out. So they just think that the best option is to stop the struggle. The fight is just too much. So that hopelessness usually cuts across many cases of suicide, whether it's from a medical point of view or societal pressure. They just feel hopeless and they just cannot continue anymore. And they even think sometimes that they'll be doing the best thing, for everybody, to just stop existing, to stop living. Yeah.
Awesome.
Yeah, so just to add to that also, I think there is also the element of pain. So it could be physical pain, it could be emotional or psychological pain. So there is that pain that the person is in, and they probably see ending their lives as the way out to end the pain for themselves and maybe the people around them. So that's also another angle to how suicide can be perceived, as the end of the road, as the end of the pain. And there is that hopelessness, obviously, because where there is life there is hope, but at that particular point in time the person doesn't see it that way. So
what are the risk factors? What can people kind of have at the back of their mind as possible risk factors for suicide?
Okay, so there are several risk factors. One, I'll start with the fact of having a previous attempt at suicide. So most people that eventually commit suicide or die by suicide may have tried to commit suicide in the past. Also, expressing the desire to die, either to family or friends, actually is a high risk factor. The person might likely actually eventually try and then succeed eventually. Likewise, having a history of deliberate self-harm. That means person tries to harm themselves in some way or the other, maybe without intending to actually kill themselves, but then these are acts of self-harm. So that's actually a high risk factor for possible attempts in future to try to take one's life, as well as psychiatric conditions or mental, even general health conditions. For example, psychiatric conditions, depression, where you have marked mood changes, insomnia, hopelessness. Also have schizophrenia, for example, actually in people that have very severe schizophrenic or psychotic illness, and maybe especially they are young people, and then most times they actually feel sad, accompanying, imagine themselves acting strange or abnormally, so they actually feel very sad. These are some of these risk factors actually predisposed to suicide.
So I'll talk about the social factors, but also adding to some of the mental health conditions that could have suicide as part of some of the symptoms is postpartum depression that new mothers struggle with. Sometimes it can get extreme that leads to suicide, bipolar disorder, severe depression. And the social factors that can also be risk factors for suicide is economic crisis. You find that even data has shown that in places where there is a lot of economic crisis, high inflation, they see a rise in suicide cases. Difficulties coping with life stressors. So you're looking at maybe a situation where the stress of living has become so unbearable. That could also be a risk factor for suicide. So even if the person doesn't necessarily have a diagnosis for a mental health condition, the social issues around them could lead to that. Academic pressures too. Academic pressures have shown very high rates of suicide in many countries where they are unable to keep up. Even in Nigeria, we've been seeing recent news of a lot of young students ending their lives by suicide. So these are some factors. Relationship issues, right? Relationship issues, as simple as it may sound, some people have gone so have struggled so much that it led to suicide. So these are some social factors that can lead to suicide. So basically anything that disrupts your ability to live a normal, healthy and happy life can be a risk factor for suicide.
Very well said. Very well said. Outside the studio, we had the conversation about stigma and the role that stigma has played, and we know that stigma has killed more people than it has helped them. How can we combat this issue of stigma? How can we combat the issue of stigma when it even comes to preventing suicide and helping people who may have suicidal thoughts?
Well, I think for stigma usually arises in part due to lack of knowledge
Yeah.
or fear. So, in trying to combat suicide, you have to start with maybe education and normalizing conversations around mental health, like speaking about it from the rooftops, literally, like openly, like a physical health, like a mental health. I mean, like the same thing, more or less. So, talking about it and getting people, I mean, more open to hear or discuss their mental health with family, friends can go a long way in reducing stigma and thereby making people easily access help or seek help when they have problems that require attention. So that, of course, on a personal level, each individual being more aware of mental health problems can now be more empathic to their friends, colleagues, and even look out for them. You won't say, I'm observing you, you've been down, been moody. I think, okay, don't worry, should be fine after a while. But really, if we're actually mentally health aware, really for our neighbors, you have to show more concern, and try to reach out to them. And not even, of course, if somebody even has a mental health problem, how do we treat the person? Do we think the person is already damaged for life, cannot function, So really trying to be more humane in our approach, know that everybody can actually have a mental health condition at any point in time in their lives. So really it can help us to make it more normal, like one more illness.
Definitely.
I'll talk about that from the support system angle. So you've mentioned the education, but there is another angle of suicide prevention that makes it hard in terms of the stigma. There is a lot of shame and guilt that is put on the families or loved ones of people who have died by suicide. And many a times also that stigma, that fear of what we people say, how will they treat us, makes a lot of people suffer in silence until they end up dying by suicide. So we don't even know until they are gone and they're like, oh, there were these signs, there was that. But we are in so much denial. So that shaming and stigmatizing of families, which makes it difficult for families to open up and speak about the loss of a loved one, because experience is the best teacher. They say, sadly, this is an experience we don't want, but there are so many lessons that could be learned.
Yeah.
There is so much in the education when you're listening to someone who has experienced a loss by suicide, telling you these are the warning signs that they missed that you could pick on. But we shame them, we stigmatize them, we put the guilt on, we put so much pressure on them, make them feel so guilty, like they failed in their duties. That's why you lost a child by suicide and all of this. So that's another angle we need to look at. Being supportive to families and loved people who have lost their loved ones to suicide, so they'll be able to talk a bit more about it and create the awareness and the education that can reduce stigma.
Awesome. What you said just reminded me of a conversation Dr. Nancy and I had outside. Well, you were there too, outside the studio, where we said, one of the risk factors for suicide is also family history. And I know, Dr. Nancy, do you want to bring up the conversation about how, families are actually shamed for it and people, and that stigma also plays a role. So please go for it.
So we are aware that there's a genetic predisposition to mental health conditions, right? Or other similar illnesses, in general, even physical health conditions have genetic predisposition like hypertension, diabetes, right? So sometimes we also found that there's some genetic association between maybe mental health or even suicide as well. But the factors that contribute to the family history of this condition is not very clear scientifically. Okay, so these are maybe they have a family history of mental health conditions, so that is giving rise to several suicides in the family. Or is it that maybe they're trying to mimic, maybe somebody has died of suicide in the family, and that person now feels okay, or if he or she has gone, you just follow them and go as well, and all that. So, like, trying to copycat or mimic the suicide of somebody else in the family, right? But as she said, it's important not to overemphasize or stress that, because that's adding to the stigma to the family, right? And now see, that's even going to make the risk of suicide in the family higher if there's stigma on them that somebody died by suicide in the family. Then they'll definitely they'll be more at risk of having maybe depression from that, overwhelmed, also hopeless again, they failed, and that can also lead to suicide. So that can actually contribute to that family history of suicide, because they are being treated badly or not, wasn't managed properly by the authorities or the media, for example. Yeah.
I think for everybody, the take home is that we need to start to watch the narrative and the words that we use and how we talk about suicide, because one, speaking actually does help, but when you use the wrong words, when you bring in stigma, when you are not aware of your own your own biases and you bring that to somebody who is already struggling, it actually does make it harder and does make it, difficult for the person to even open up, because a lot of the time we're saying, oh, reach out and speak. But if I'm speaking to you and you are just making me feel shame, making me feel like it's my fault, making me feel like I'm this weak person that cannot deal with the struggles of life, then you're not helping me. So the words that we use go a long way in helping us to combat the stigma. I mean, education goes a long way. We need to start to we need to start to learn. Even take some time, go and read up on it. We talked about even the fact that we don't have enough data in Nigeria on things like this, because that would feed a little bit more and help people understand the severity of this problem that we have in. And because sometimes when it's put out there in the media, the way it's painted, you're like,
and it can lead to copycat suicides depending on how they report, because even reporting of suicide in the media, there is a very specific way that's supposed to be done.
Yeah.
You shouldn't talk too much into details about the method the person used to end their lives. You shouldn't talk so much about maybe if they left a suicide note and the reasons, disclosing it to the public. Other people out there who are vulnerable, it may end up giving them ideas on how to do the same thing. So copycat suicide is actually also a very big thing, and it still comes to the reporting, which we need to do a lot better in terms of how media is sensitized on how to go about reporting such.
Definitely. Let's talk about mental health and resilience. Resilience is a lot. It's one of these words, one of the words that we're hearing a lot because of the role it plays. It plays quite a significant role in its ability to, I don't like to use the word bounce back, but it's ability to come back from a hard place, it's the ability to come back from suffering, it's the ability to come back from a downtime in your life. That ability to, for lack of better word, bounce back and come back and be able to, function within society. That a lot of it has to do with your resilience. But let's talk about resilience and mental health. What are the strategies? How can we begin to teach people to, how can we help people develop coping strategies and coping and resilience and build their resilience? Because we know that we are all at some point in our life going to suffer with our mental health. We may go down, at different levels, but we're going to face some challenges. How do we, bring strategies in that we can teach people at the home level, at the school level, at the different facets of life? I know this is like a loaded question. Well, please break it down. How can we build resilience in people? How can that be taught to people generally?
Okay, so there are several ways, but as you said, resilience is built, right, over time. So I'd like us to go back to the basic cell of society, the family, for example. It starts from there. If an adult or a teenager is on social media but has not had any training on resilience from home up to that stage in their life, they'll easily be tossed here and there by whatever they see, or that can be a pressure on them. So I say, starting from the home, right? The parents have the time to show their affection, to bond with their children, and to train them in an appropriate way, or we're trying to give them the easiest life possible, and not even teach them any kind of form of resilience to withstand any adversity of any form. Of course, it doesn't mean that you have to now punish them or make them, suffer or maltreat them or abuse them literally to make them strong. No way. But the fact that many people actually are not having enough time to train their children from the home front, right, and be there for them, to be able to have a confiding relationship with their parents. Now, when people don't have a confiding relationship, right, as adults, they are more vulnerable to depression and other illnesses. Therefore, they are more at risk of suicide in the long run, right? So trying to build that from the home front, right? And also prioritizing things that are more important. For example, I was talking about, mention sleep, right? These are very simple, basic mental health promotion tips. What is the sleep pattern in a family or in a home? Most people now pride themselves on working so much and they don't sleep as they should. 7 to 8 hours per day for adults, children even more. And our children have phones, they're spending the whole time, they're not even able to sleep as they should and rest well to have to be mentally healthy, right? These are ways you can actually build resilience even before you get to the forefront of the battles. So like the normal routine, right, in a house, in household, sleeping as you should, talking to your parents and sharing things and being that cohesive unit. In suicide, people actually have social isolation. When they're alone, they are at high risk of committing suicide. So if, imagine someone does not feel any cohesion in their family, Then of course, but they go to their workplace, they won't have any friends, or you can just play out in that manner. So they'll be more at risk, and they won't. So in that way, I think trying to build all those things that are like basic foundations of human society that we should have there can go a long way in prevent in having mature adults who are actually resilient. Of course, even in the workplace, right? For example, right, we all prioritize getting those accolades, right, at the cost of what exactly? So truly, trying to prioritize, what is really is good for us to be mentally healthy at any point in time. See, so if I'm not mentally healthy, any any adverse circumstance, maybe economic downturn, unemployment, I lose my job, I'll just quickly tip to the point of depression, mental illness, or suicide, right? But if on the other hand, I'm already mentally healthy, I have coping skills that I've learned over time, at home, in the workplace, I'll be able to do better. So that's just my take on that, really.
Thank you.
So I'll look at this from two angles. The first one is in terms of catching them young. So resilience is something that some people may naturally just have higher resilience than others, but it's also something that can be built. It's not set in stone, right?
Yeah.
So building positive life skills in children at a very young age, teaching them assertiveness. It's a good communication skill where you're able to express yourself, where you're able to confidently say yes or say no to situations that make you uncomfortable, right? Building their self-esteem. These are all skills that if one has it would influence their decisions in life. It would influence their life view and how they face challenges. The second one is in terms of support system that is there in our society. If you look at advanced countries, you see that once there is an adversity or a crisis, immediately it happens, there are a lot of support systems that are put in place to help the person bounce back, right? You would find that even mental health support is available. We don't have so much of that here. People go through so much. Let's even take an example of people in IDP camps. If you've been to an IDP camp and you've seen the living condition, there is no how you would expect someone like that to immediately bounce back and have high resilience. But imagine if you're moved. So moving from where you are used to is a very terrible thing. But if you are moved to a place where it's a bit more comfortable, you have access to a job, you have access to school, your education continues, you continue to earn an income, you are more likely to bounce back faster. So these are all systems, social welfare systems that we need in place to help build people's resilience. It's not enough to make it an individual responsibility. It's also a societal responsibility. It's where government comes in. It's where workplaces, schools, everyone comes in to make that happen for every individual.
Awesome. Brilliant conversation. I think again I must reiterate that, if you or anyone you know is struggling with thoughts of self-harm and suicide, please contact us and then we'll be able to provide the right resources and support that you need. Remember that our number is 0706 062 5054. And our final question for our amazing guests that have been in the house and that have actually spoken a lot to the conversation. As practitioners, it's important that we always go out with resources. What resources are available? What resources can people hold on to? Dr. Nance is a psychiatrist at Oliester. Aisha is a psychologist running her own private practice, all in Abuja. But then also for the people that may be listening outside, just give us everything. What are the resources available? Oh, by the way, the sanctuary is also available. And you can use our resources too. So tell us, what are the resources available that people can use for suicide prevention?
I think the internet has helped us a bit. Now, if people search suicide help, they might come across some helplines, right? Toll free. So, well, maybe not all are toll free, but in principle they should be toll free. We should work towards making them toll free, right? Mm-hmm. But there are some helplines that are for suicide or for mental health conditions. Okay, I know there's one by the Suicide Research Prevention Initiative in Luth, that's in Lagos, but definitely is a line. So, the essence is to reach out and then they can now signpost you to where you can go to for mental health care, right? And also trying to reach out to different mental health outfits. Actually, once you reach out to any mental health facility, that's already a link to a help, really, right? So I guess other people can give you a number if you have any number available to give out to the audience, Aisha.
To add to the toll-free line, we have a We run a mental health helpline and suicide prevention helpline on the national emergency number 112, but we are currently active in Abuja. So when you call, you can ask to speak to a counselor, and it works 24/7. So many a times we tend to attend to suicidal calls in the middle of the night and all of that. So you can reach out. It's an emergency support, so which means we will be there with you during that emergency, but we will link you up to further care if you need. And like you said, the internet has made things easier for us. Once you Google suicide support or helplines in Nigeria, you will likely find some credible organizations. You could reach out to other NGOs that could link you up. And another resource to read is also check out credible sources. World Health Organization has a lot of data and information on how to support someone who has suicidal ideations. There is if you check our website www.thesunshineseriesng.com, you'll find resources on our resource hub page on preventing suicide, on supporting someone who has suicide ideations, on supporting someone who has lost a loved one to suicide. So these are all resources. They are obviously not enough for our over 200 million population, but it's a step in the right direction. And the more we talk about it and create the awareness, the more we can now demand for more resources to be out there, especially also from the government and all the other institutions that support the government.
Awesome. I think the take home for everyone listening is that there is help out there. Just put in a little bit of the work of doing the research, reading up a little bit, going through the internet and looking for reliable sources like our guests have rightly put out. And if you're in Abuja, there's the 112 emergency number that you can call. And remember, it's for you to seek help, and it's for you to reach out and get the right support that you need, because we have resources available. However shape or form they come, there's something available to you. Your general hospitals also, sometimes they are the closest to you that you can go to, and there are practitioners there that'll be able to also support you and give you the right care. Yes, Dr. Nancy.
I think I also want to add that you can seek help by proxy. That means, imagine if you have a friend, a relative is going through a tough time, maybe they won't be able to muster the courage to go and start searching online for help. You can help them with that and then organize the help they need for assessment or a session with the therapist.
In fact, many suicide attempt calls we've received is someone reaching out by proxy, so reaching out on behalf of someone, and we guide them through what they should do till the person gets appropriate care and support.
Brilliant. So reaching out is both ways. When you need the help, reach out. When you see someone who needs help, reach out. So it has to be both ways. Yeah. So let's help each other to build a mentally a healthy society. Thank you so much to our guests for this brilliant conversation. Thank you to you also for listening. The show wouldn't be possible without you. And thank you for taking that time out. Remember to follow us on our social media platforms, Twitter, on Instagram, Name Sanctuary. And again, if you're struggling or you know someone who's struggling with suicide, like we've said, there are resources out there. There are numbers that you can call. There are people you can reach out to. You can reach out to your loved ones that can help you put in the legwork. But always remember that you have to reach out. There's a reaching out that has to be done. So until our next episode, remember to stay mentally healthy.